You are.
Hello, everyone, and welcome to this edition of a Fire Rescue Med podcast. This is your host. My name is Gary Ludwig, the immediate past chair of the EMS section, and I have my guest with me today, who will be a featured speaker at Fire Rescue Med in Arlington, Virginia this year. And if you haven't registered yet, I encourage you to go to iafc.org/FRM and register for Fire Rescue Med. We're in Arlington, Virginia this year, right outside our nation's capital, and we have an exciting lineup of all the current buzzwords that you know in EMS, including community paramedicine and active shooter. And with me today is my guest, and that is Matt Savatsky, and Matt is the Director of Public Relations and Community Relations for MedStar Integrated Healthcare in Fort Worth. And Matt is with me today, and Matt, you want to say hi to our listening audience?
Hi, everybody, and thanks, Chief Ludwig. But can we try not put mobile healthcare and active shooter into the same sentence? And then,
you know what? I think that's. I think we're going to go along with what you say, Matt, and we're just going to stick to community paramedicine and mobile integrated healthcare issues today, and we're going to leave active shooter for another discussion somewhere in the future. How does that sound?
That sounds great to me, sir. Thank you.
Well, Matt, you are quite the expert when it comes to mobile integrated healthcare and unscheduled care, and we are really blessed with the fact that you're going to be with us at Fire Rescue Med this year. And you're doing a pre-con, and you're also doing one of the general sessions. But let me just kind of pick your brain a second and talk about what are some of the session goals that you're going to be trying to convey to the audience that's going to be there at Fire Rescue Med this year.
Well, Chief Ludwig, the concept of community paramedicine and mobile integrated healthcare is clearly the #1 issue in EMS and really, quite frankly, most healthcare circles right now in the country. It has been shown time and time again to generate interest not only from EMS providers, but policymakers and payers. We just had a conference recently with over 250 people in the room, and just when we think that, gosh, everybody who could possibly want to know about this has probably come to some type of a session, we find that there are actually more people that want to come. And the fire service, as we've been saying for, gosh, since we started doing this several years ago, is very uniquely positioned to be successful in transforming into a mobile healthcare delivery model, and really needs to help other communities learn how to do that. And we're hoping that through this session, doing it with you, because you are also a very innovative fire service leader and EMS leader, help folks identify what are the gaps in their community that the fire service MIH can provide or community paramedicine can provide. What are some of the issues that you may have with your community or your workforce, or folks that might not be as up on mobile integrated healthcare and community paramedicine as the fire service leaders, maybe breaking down a little bit of the us and them mentality with some key strategic partners in the community who might not view a fire service provider in their community as someone who can do mobile healthcare services and be integrated into the healthcare system, and build community support to be able to, talk with, like Chief Ludwig, you're doing in your community here soon, getting all the hospital CEOs together, getting the payers together, getting the city administration together, or the county administration together, to really have some value that the fire service can bring into this transformation of our EMS systems into mobile healthcare systems.
You know, Matt, I can't see, you talk about an episodic event occurring in our profession. The fact that mobile integrated healthcare is coming about is such a change and such a dynamic that's occurring. I mean, we've been working under this model of 50 years or more. You call 911 and we take you to an emergency room regardless of your chief complaint. And so, when you talk about getting your community involved, you're talking about who when you talk about that, Matt? Who you're talking about? The other healthcare providers or the citizens, or who are we talking about on stuff like that?
Well, Chief, if you think about the term integrated, it's every type of community member who you want to integrate your healthcare delivery with. So it's the patients, it's the hospitals, it's the physicians, it's the social service agencies, the non-governmental social agencies like the United Ways and the Area Agency on Aging. It's certainly your elected officials, your appointed officials, your state regulators, your local regulators. If you're in California, you've got 15 different levels of regulation. They all need to be there. So what we have found, and one of the things that helps us and others that have been doing this for a few years, is we have the scars of learning who we didn't invite to the table in the beginning that we probably should have, to kind of help people work through that. And that, as you had mentioned, that term community is truly at the heart of what we're doing. And you need to invite all of those folks that could possibly be interested, and interested is an interesting term. The home health agencies is one that we talk about quite a bit, helping them understand that you might not be a competitor of theirs, but in fact you might be someone that could help them. So to your point, Gary, I think the community definition is however you as a fire service leader entering into this arena is going to define community, but it certainly involves all of those folks. Oh, and one we left off talking about was the payers. The United Healthcares, the Cignas, the Humanas of the world. We've been very successful with CMS recently here, inviting all those folks to the table.
I would agree that the payers are important, and because we continue to see healthcare costs just rise and rise and rise each year, and when we talk about healthcare reform, this is, I guess by definition, a component of healthcare reform. And why would we want to reform healthcare? Is it mainly because of the cost keeps rising, or what's the reasoning behind that, Matt?
Well, the IHI, the Institute for Healthcare Improvement, and the Center for Medicare and Medicaid Services have been subscribing to the concept of the triple aim, which is improved patient outcome, and including their experience of care, improved population health, and reduced costs. So as we talk about why this is happening today, the Affordable Care Act has created this amazing alignment of incentives where the payers, the providers, the hospitals, everyone is incentivized financially to meet that triple aim, to improve the patient's outcome, improve the health of the population, and reduce costs. And these models are gaining traction and growing very quickly because we're, for the first time in our profession, we have found people who are willing to discuss patient outcomes that don't involve them coming to the hospital, and payers being willing to pay for things that aren't transportation related. And that is a world that you and I have dreamed about for years. Well, it's here. How do we capitalize on it? How do we improve the patient's outcomes and reduce costs?
And I know how a lot of fire service departments, they kind of think that. So you're telling me there's more money possibly in the future here for fire departments that they can tap into? Is that what you're saying is going to be happening here?
And you're beginning to see it. In our session, we're going to highlight some of the fire agencies that are doing this very successfully and getting paid for it. Places like Mesa, Arizona, and Green Bay, Wisconsin, and a number of others that are getting paid by payers and or hospitals to navigate patients through the healthcare system and not just do what we've always done, which is, well, you call, we haul, that's all. It's a whole new world, and this is something that I know for our organization at MedStar in Fort Worth, we've gone from doing the out-of-pocket spend to prove concept to nearly $1 million in revenue this year from these services that don't bring patients to the hospital.
$1 million, wow. I know a lot of fire departments that would certainly love to tap into that. So what you're saying is there's opportunities and challenges here, basically, with this whole new healthcare reform and this whole concept of mobile integrated healthcare. So we talked about some of the opportunities. Are there any more opportunities, or is there any more challenges that we can talk about when it comes down to this whole new concept and whole new model?
There are many in both categories. There are amazing opportunities and significant challenges, and that's why it would be good for everybody listening to this podcast to go to that website that you had mentioned, log in, come to the conference. It will be well worth the investment of time and resources that you spend, because you're going to walk away from the session that Chief Ludwig and I and others are going to be doing throughout that program, walk away with actionable items so that when you go back to work on Monday, you're going to have a checklist of who to start calling first, who to bring to the table first, so that if you are interested in doing this, we're going to help you with a blueprint to get it started.
So basically what's happening here is this is moving forward. There's momentum behind it. Services and agencies and organizations and systems are starting to change, and you can basically get on the train, or you can stand there and watch the train pull away from the platform and wonder what the heck happened. And so obviously those opportunities and challenges are there. So,
or you're going to get run over by the train, Gary.
Right. So I guess that's, you're right. I guess that light coming at you. it's not a career dissipation light so much as it might be trained too, that it could dissipate your career real fast. So
one of the things that the attendees will learn when they come to these sessions is that this is going to happen in your community if it's not happening already. And it is going to impact your call volume. And if I were the chief of a department, I would like to be the one who is going to get paid for reducing my own call volume rather than the one that has the call volume reduced because someone else is getting paid for it, and now I've got to go to the city leaders and say, you know, our call volume was a little off this year. We're about $1 million short. Can we get, you know, an extra $1 million next year?
Yeah, I don't think many chiefs could go away and go in front of their city councils and try to justify that. It'd be very difficult. I think probably what they would hear is, well, chief, it's up to you to start cutting where you find it appropriate since your run volume is now down and you're not bringing any income in. So there is doom and gloom when we talk about this then, isn't there?
Yes, but in the intersection of doom and gloom, there is some incredible opportunity. I know we were just talking earlier about some innovative entrepreneurs who have navigated that doom and gloom and created some opportunity. This is a unique time in our profession, and I would argue a unique time probably in the fire service. Much like EMS did for the fire service 30 years ago, this transformation into mobile healthcare could be the next big revolution in the fire service that really partners the fire service with their local community, with payers, with patients, with hospitals, to really become an integral part of the healthcare system in your community.
And you know, for the average person on the street, the average firefighter or paramedic that is going on one of these calls that is a low acuity, low priority type of call, these types of models in the future are certainly going to alleviate some of that in the call system, as I understand it, if you properly implement these things into your system. Am I correct, or am I off base with that?
No, and we've seen that in our community and a number of communities across the country that have done this. And depending on what programs that your mobile integrated healthcare strategy is going to take on, one of the most commonly referred to is the frequent flyer, or what we now call the EMS loyalty program members. And you know, when you can get those patients connected to the right resource, when you can teach them about the disease process, the goal is to reduce their reliance on the 911 system, reduce their reliance on the emergency care system, to get them to their primary care network, be managed more appropriately, healthier, better outcome, reduce cost, IHI triple aim, and by the way, it's going to reduce the call load on the emergency ambulance resources that are deployed in the community.
And you know what's cool about the fire service being involved in this is that we can do other things, including if we're going to a home, we can also be checking for smoke detectors and some other types of events that can help keep or other type of adverse type of things that can keep the person healthy. So that, you know, those are some of the dynamics the fire service can also bring to the table when we talk about mobile integrated healthcare, especially in a home setting. And but you know, one of the things that we also want to talk about is like you just said, it was that opportunity, and those opportunities do abound. So, well, Matt, we're getting close to the end of our podcast, and is there anything else any juicy tidbits that I haven't had a chance to ask you about that you think is important for our listening audience?
Well, I think the only thing we want to leave the listening audience with is that this is a very short window of opportunity for these folks. And there are many, many agencies, including hospitals, including physician call services and home health agencies, that are looking to operate in your space, in the fire service, to reduce 911 call volume, give patients personal emergency response buttons so that they can call them directly instead of having to go through the local emergency response system. So come today, learn today, so that you can become part of the solution today instead of being impacted by it tomorrow.
Absolutely, because you know, it is certainly an opportunity if you are a fire service leader to write the future of EMS in your community by some of the things that we're going to teach you at this conference. So with that said, I want to thank Matt for being with me today, and you'll be able to see Matt and myself at Fire Rescue Med, which is going to be April 30th through May 3rd in Arlington, Virginia. April 30th and May 1st are actually the pre-conferences, and Matt and I are doing a pre-conference on the mobile integrated healthcare. And then Matt is also doing a general session along with a couple other general sessions on Saturday, May the 3rd, on mobile integrated healthcare. In fact, there's going to actually be 3 sessions that afternoon, 3 general sessions on mobile integrated healthcare. And with that said, you know, it's an excellent opportunity to learn from a bunch of fire service and EMS leaders at this conference about mobile integrated healthcare. So I encourage you to go to www.iafc.org/FRM to find out about our program and also to register. And what is also fantastic about this conference is that it is being done in conjunction with the Congressional Fire Services Institute dinner, which is going to be Thursday night, May the 1st. So if you're coming to the dinner, we would certainly like to have you come to our conference. And if you normally go to the dinner, we want you to come to our conference. You can also go to the dinner at the same time. So it is certainly an opportunity to kill two birds with one stone on one travel to the nation's capital. So Matt, thank you for being with me today, and I appreciate it. You know, you truly are an icon and a professional in our profession. You truly are, Matt. You have set the pace for so many here, and certainly, you know, it is such a unique opportunity to change things like you're doing. So, but bless you for doing that. And I thank you again for all listening, and I hope to see you at Fire Rescue Med this year.